Today we're talking to County Commissioner and Chair of the county's Board of Health, Tye Menser, about what decisions are being made at the Thurston County Board of Health. Hi, Tye. How are you doing?
Good, thank you.
I'm so glad you could join us today. So, without safe levels of public health, our economy can't move forward. The advent of the pandemic puts the public health department leading Thurston County towards the recovery of the economy. So what do you see as upcoming challenges here in Thurston County in the battle against the COVID-19 pandemic?
The first challenge that we're facing is the vaccine rollout, and the pinch point for us has been the supply. We were well positioned to create clinics and kind of create the infrastructure for vaccine rollout, but without the doses coming in at the levels that we were promised or expected, it's been hard to follow through, and that's been frustrating for the community. We need to get that supply ramped up and stabilized so that it's predictable, so we can plan the right events in the community to get the vaccines where they need to go. I think we're well positioned to do that, and I know there's a Johnson & Johnson vaccine has requested a emergency approval, I think today or yesterday, and that could hopefully help ramp up supply. We're also, there's going to be a struggle with the overlap as the vaccine rolls out, and it's going to take a little longer than probably people thought. There's going to be people who are vaccinated and people that aren't vaccinated, and how those people interact with each other is going to be important. It's important that people who are vaccinated still continue to practice, public health safety measures like distancing and masking, because there's a little bit of an unknown about how transmittable folks who've been vaccinated, are to the other folks in their workplace or in their household. So that's important. And the third challenge is the unknowns about the strains and variants that we're seeing from, the Brazil, South Africa, UK variants. They're more transmissible according to the evidence that we're seeing. And so knowing how they're going to affect vaccines and everything else, schools, et cetera, is another dynamic that we're going to have to, watch closely in order to meet that challenge.
So how has the Board of Health taken the lead to get the county out of this crisis?
So right out of the gate, we declared an emergency, which does something kind of important from a legal standpoint. It allows us to move quickly. The government doesn't always move very quickly. We have processes and procedures in place for contracting, for acquiring supplies. But when you declare an emergency, you're able to move much more quickly. So we were able to acquire, for example, mobile testing units, which at the beginning was important, getting down to South County and other hard to reach locations with testing. We're now using those same infrastructure and vehicles and stuff for vaccine clinics. We were able to, contract, we had to build up contact tracing in order to get, for example, from phase 2 to phase 3 back last summer and get our economy more open. We had to show a certain capacity of contact tracing capability. That required staffing. So people had to be hired very quickly. And of course, there was competition for that because every county was in the same boat in a sense. So we were trying to get people on board and trained and ready to go as quickly as possible. We also had the coronavirus relief funds. This was a substantial block of federal money that came to local governments back in the first round, back last spring, of relief money for local governments, some of which was to directly respond to the pandemic, and other parts of it was more flexible. And we allocated, I think it was over $16 million to various pieces of the community, and we had to decide very quickly how to do that. Our Economic Development Council worked with us, created a coalition called Thurston Strong that was able to kind of handle the economic development, small business micro grants, childcare needs. They had a kind of a 4-part program that they developed, and then we had the confidence to allocate our money to them because they really put the pieces in place. Then on the social service side, we had United Way and the Community Foundation that put together kind of a similar coalition among social service providers, what their needs were, prioritizing needs and getting money. So we allocated money there. We also created a rental assistance program, and the Community Action Council stepped up to help us administer that. And millions of dollars went out in the community on that front. And then I'd say third, just activating so we activated our emergency management. We have one of our new nice facilities in Thurston County is our emergency operations center. And we activated that right from the get-go to coordinate across all of our different departments and rotate leadership through, because it's been, it's been a marathon. We've been, people have been working overtime in kind of an emergency, orientation for 11 months. So that's been, a real effort, and I think something that maybe the public's not 100% aware of, but the county's been working in operationalizing its emergency management plan.
So in the mission statement, the Board of Health asserts that they're working together to achieve the highest level of health and well-being for everyone. What measures does the Board of Health have to ensure equal access to health to all residents of Thurston County?
Yes, well, equity has been a focus of the guiding principle of our public health department. We've made a number of steps to increase that focus here over the last year. We work to remove barriers and increase partnerships to serve the entire community. Specifically in the pandemic, we have, as I said, we have the mobile testing units for vaccine, as well as coronavirus testing early on. We were down into Nino, Rochester, Yelm, different areas, reaching those same outreach to the houseless community, making sure that folks had access to those services. There's been tireless outreach by our public health staff to particular groups like the senior centers, senior services for South Sound, going out to congregate care facilities. And we've had, I don't know the total number, but we've had a large number of outbreaks. And an outbreak is considered very broadly as two or more cases in a congregate living facility or a workplace or a school is considered an outbreak of and so those have to be handled in a different way according to state policy. So we work there, retirement communities, mobile home parks. For example, public health held a 40-person clinic just this week for seniors who've been working through a phone apparatus for folks that aren't able to get to a physical location. So we've tried to provide different opportunities. The computer is a wonderful tool to cross geographies, but within socioeconomic groups or particular places that don't have good internet broadband service, you have to go further than that. And so we've been working on that. As I said, kind of doubling back to what I said in the last answer, we've worked hard with the United Way, Community Action Council, Community Foundation to make sure that social service needs were met. As the economy is affected, that affects fundraising and budgets of all these groups that provide core services to the most vulnerable citizens. And I was adamant that we make sure that some of these coronavirus relief dollars, an adequate proportion of them, went to those methods.
That's great. So how healthy are we right now in terms of mental health? Suicide is a concern, drug abuse, houselessness. Are there issues there that we're concerned about?
Yeah, of course. Mental health has been a theme. I'll report on one positive thing, for example, and then I'll kind of get to some of the more concerning things. The positive is that, we were really concerned early on about suicide rates. There's been talk about, among youth, because of the folks losing their job, kids aren't able to go to school. And we did see in the early months of the pandemic a spike in Thurston County suicide rates to where we thought that we were going to be higher than ever before. For example, typically we'll have about 55 suicides in a year. We were on pace for about 80 mid-year. And that leveled off, though, in the second half of the year. The coroner has reported that those numbers fell pretty dramatically, and we ended 2020 right about on target with previous several years. So that's, somewhat good news. On the other hand, though, like, for example, one of my roles as a county commissioner is with the Behavioral Health Administrative Services Organization, what used to be the BHO, which deals with mental health. They have they run the crisis response. And I know from my work there that calls are dramatically increased. We've had to increase staffing to meet the demand. So I know that mental health crisis calls are up, and that's concerning. Um, Substance abuse, I also serve on the opioid task force. I think that there has been a kind of an uptick. We've made some really good progress because of the public health emergency and the staffing and resources we put into the opioid epidemic. But that has slightly increased through the pandemic and kind of reversing some of our gains, we're afraid. And then homelessness, we just did the point in time count. We don't have the data yet. We did it in a different methodology because of COVID-19. We did it on a kind of a more self-reporting and just a slightly different methodology. So it's not going to be apples to apples numbers, but we did the best we could under the circumstances. My sense is that the numbers aren't necessarily increased, and I think that's partly because of our rental assistance program. But conditions have deteriorated in the sense that shelter space is down because of the social distancing requirements, where you might have been able to pack 150 per people into a shelter, now it's maybe 60. So that's decreased the number of shelter beds. The cold weather hazardous task force that we have, a coalition to create extra shelter space during cold weather conditions. We don't have as many beds for cold weather events this year, which is concerning. So I do think there's an issue there, even though it may not be we've kind of kept the lid on homelessness numbers, but there are concerning conditions around the county.
So vaccinations are on everybody's mind. So how is our vaccination process going here, and when does somebody know when they're eligible to get a vaccination?
I'll start with the second part of that. There is a website developed by the state, Find Your Phase, PHASE.org, walks you through some questions and helps you figure out what tier you're in. Now, knowing what tier you're in or phase and tier is not very helpful right now because we're still in the first group. And as I said, we have 70,000 people in Thurston County that qualify in that first block. And we've only gotten, a fraction of those vaccinated because of the supply. The state has a pretty complicated formula as to how they get their allocation from the federal government. I assume that's by population, but then how they divvy them out to the counties is partly based on population, but it's partly based on other factors such as how many approved providers you have. We have 43 approved providers in Thurston County, which is a good number. So they're looking at different metrics, including what, they've got some state mass vaccination sites lined up. And so we're not sure exactly how many we're going to get week to week, which has made it hard to plan the rollout. We do have the infrastructure in place for mass vaccination sites. We are planning a drive-up site at SPSCC, that's the local community college, South Puget Sound. We are working up a walk-up site in the fairgrounds, but these are for the future when the supply starts to become more robust and stable. We're just being prepared so that we can show the state we're ready to go. You can trust us to get these vaccines, because remember, when you get them, you have to have the cold storage for example, the Pfizer, and I think Moderna as well. There are storage requirements, and they have to be administered completely within 7 days. So the state's not going to give the county the vaccines until they can show that they can meet those requirements. So it's kind of a give and take. We've been working as hard as we can to show that we're ready to accept as many doses as the state can provide for us.
Great.
So it's been frustrating, and we know that the decentralized way of the rollout has been somewhat frustrating. There's the healthcare networks are being utilized, pharmacies are being utilized, public health departments with community clinics, and then the mass vaccination are all part of the state's layout, and we're just trying to follow that guidance.
Okay. What percentage of our population needs to be vaccinated in order for Thurston County to be considered healthy and safe? And how quickly do we think that this is going to happen? Or how quickly does it need to happen?
So the thinking on that is evolving. But at the beginning, fairly recently, it was thought that if you could get to 70, 75%, you'd be in a really good shape across the county. And the hope was to get there by summer. if the new strains, new variants take hold and with their higher transmissibility rate, you might need to tick that percentage upward, something more like 80%. The goal, though, is still nationally to get there by the end of summer, so that by fall 2021, we're in a good position to feel like businesses can be reopened, schools can be reopened in a very more normalized way. That's the goal. But if we don't, if we don't work hard between now and then, it's not a guarantee we're going to get there. It's going to take a community effort.
Right. And it's not just the vaccinations, I'll say it. It's masking and social distancing and all that other stuff that needs to happen. So is there anything else you'd like to add?
Yeah, just kind of following up on that final point. It's really important that folks understand that we all want to open schools and our economy as quickly as possible and as safely as possible. And we get there quicker when we all buckle down with the public health measures. We're all tired of them. I guarantee that I'm as tired as anybody is with all the measures, especially during this winter when people aren't able to get out doors as easily. And I'm hoping that the spring weather will really kind of help that. People should get outside. It's good for your physical health, good for your mental health, good for your kids. But even having a vaccination, don't let down your guard, because until we get to that 70, 75, 80% vaccination across the community, it's going to be just as important to continue those social distancing, public health safety measures as it was at the beginning in order to get us opened as quickly and safely as possible. And I know it's a marathon and it's difficult, but we really appreciate everybody's effort in linking arms with us on this and getting it done.
Yeah, well, we will get through it because we're all in this together. So thank you for being with us, Commissioner Menser. We appreciate your time. We know you're busy, but we appreciate that you've taken time to be with us today. And thank you for watching. For more Stay Safe episodes, go to our video on demand at TCMedia.org. And if you know of something you think we should cover or information that we should deliver, send us an email at staysafe@tcmedia.org. Stay home, stay updated with Thurston Community Media, and stay safe, Thurston County.